Hey, thanks for staying with us here on Sunrise. Welcome back. If you're just joining us, thanks for coming along. We're taking a sharp left turn. We're going into the world of men's health to talk about BPH. That's benign prostatic hyperplasia, or an enlarged prostate. It's a condition that affects men as they age, often bringing frustrating symptoms and uncomfortable treatments. But a new option called Rezum water vapor therapy is offering relief without the usual risks. We have consultant urologist at the University Hospital of the West Indies, Dr. Belinda Morrison-Blidgen. She joins us to explain how it works. Welcome, Doc. How are you doing?
Good morning. Thanks for having me.
Well, first of all, let us talk about enlarged prostate, because it's something that presents in the population with a higher frequency than many of us think. But it's something that you'd probably need to go and get your prostate checked after a certain age in order to know if it affects.
Right.
But how prevalent is it in the population?
It's very prevalent. It's almost inevitable as men get older.
Wow.
So 40% of men in their 40s have an enlarged prostate. 50% in their 50s, and it exponentially increases with age. So for men in their 80s, maybe about 90% of them will have an enlarged prostate. And I've had patients in their late 30s also starting to complain of symptoms of an enlarged prostate.
How do you know? Like what's the telltale signs?
Urinary symptoms. So getting up more often at night to pee than normal, going to the bathroom and having to wait a while, delay before that stream comes out, struggling, straining to get the urine out, sometimes complications, urinary tract infection in men, or as we call in Jamaica, stoppage of water, not being able to urinate at all. So it's very, very common, and the signs are very subtle because enlargement slowly occurs with age.
And so we, I'll admit, tend to have a, I'm going to watch it. Men have poor health-seeking behavior.
Right.
And so the challenge that we face is that we have to keep on these things. What are some of the, give me 3 things that you can maybe say to the men, especially to help each other to improve our health-seeking behavior so that we can find out if we have an enlarged prostate to begin
So the
with.
first thing is to just have a trusted regular doctor that you see. That could be a family doctor, we call a GP, general practitioner, or you may opt to just have your urologist. There's some men who see me once or twice per year just to check on those things. The other thing is to have conversations with other men, because if you don't know, you don't know, right? And sometimes just to talk to other men about some of the symptoms they're having. It's not a bad thing to do.
I talk to man about them something that
the problem is that this condition can affect your quality of life. Think
and
about
you tend to think it's you one have it.
Yeah, I mean, if you were getting up 3-4 times in the night to urinate, you couldn't be effective during the daytime, could you? If your job is as a pilot, do you want your pilot to be getting up, go to the washroom 4 or 5 times during a flight? No. Or if you have to take long drives to the country, if you have to be going very often. So it's going to be affecting your quality of health, your performance at work, and it has complications. Men who have an enlarged prostate may not empty their bladders well. And if that happens, they may suffer from recurrent urinary tract infections, which can be really bad in some men.
Yes.
They can get bladder stones, which will require surgery, sometimes more major surgery, or in about 1 to 2% end up having kidney failure. So it's important to know it's not something to gloss over, really.
All right, so we've established the context so that persons now can say, all right, there is this treatment that persons may wish to explore. Tell us about it. So,
first of all, the traditional way of treating an enlarged prostate in men who are symptomatic is with medication. And men take it for life. So you may have a man who is not interested in taking a tablet every single day for the rest of his life. Because guess what? That prostate is going to increase in size with age, whether he likes it or not. All right? And then the drugs may have side effects. Erectile dysfunction, a lack of interest in sex, inability to ejaculate. And you know sexual function is a core part of
masculinity.
Exactly. So these are some of the things that affect men. Now the traditional way we treat this is taking someone to the operating room, putting them to sleep, and going in through the urethra that runs through the center of the penis to shave down that tissue that's blocking the passage. And it's very effective, and I still do it very frequently. But it has you in hospital for about 2 days. There are risks associated, minor risks, but they're there. And there are costs associated with general anesthetic. And so this is what we call a groundbreaking technology, and it's not investigational. It's been established. The Food and Drug Administration in the US approved it in 2015. So this is 10 years.
It's a while now.
And there's enough data to say that this thing works and it's effective. So what is done? It's first of all, it's done in an outpatient setting. You could come into my office and have it done without being put to sleep.
Okay.
I can give you local anesthetic to block the nerves around the prostate effectively so you have no pain, all right? Once we do that, we put a delivery device in through the center of the penis, through the urethra, and everything is blown up on monitor. So we can see the prostate tissue bulging in like mountains. And the device releases a small needle that injects in the prostate. And what does it inject? It injects steam. Believe it or not, steam causes the tissue to die in that area, all right? And the procedure takes just a few minutes. Each injection is for 9 seconds. And on average, we give maybe 6 or 7 injections. So you do the math. That's just a little bit over a minute.
Right.
Once the procedure is finished, the man has a very tiny drainage tube placed in the bladder. He gets up, he walks, he goes home. After a couple of days with the catheter in, he comes back to the office. The catheter is removed. And during that period of time, the steam starts to take its effect. It kills the cells, the body reabsorbs the cells. In some men, they even notice the cells.
Is there discomfort with the catheter being in?
Not really. I mean, it's a little unusual, but for the men in terms of discomfort of but it doesn't last for a very long time.
Okay.
Right?
Okay.
And then usually, in my experience, after a few weeks, they're peeing with a nice strong stream and they can stop taking their medication. So it's a good option for men who have a moderate enlarged prostate, even a mild enlarged prostate. They don't want to continue being on their medication because the side effects are it's not effective, or they just want something cutting edge and minimal invasive to treat their enlarged prostate.
Yeah, deal with it and go.
Correct.
And so if someone is listening to this conversation, whether it's a spouse or a gentleman listening to the conversation and saying, I really need to call doc. We need to call doc because I can't do this no more.
Yes.
How might they reach you?
Sure, they can contact me through Mona Institute of Medical Sciences, and that's 977-6883 or 977-1512, and that's on the University Hospital compound.
Is the procedure covered by health insurance?
It is, and that's fantastic.
There you go.
Which is great. Yes.
Doc, thank you very much. Learned something today.
Thanks for having me.
Today. I hope you did too. My guest has been Dr. Belinda Morrison-Blidgen, consultant urologist at the UHWI, walking us through a treatment that is making things a whole lot easier for men with BPH or enlarged prostate. Well, there's more Sunrise on the flip side. We'll be right back.